and palpate on your partner. Okay? So as I go through these things, it makes a lot of sense for you to palpate on yourself first, and then you'll move on to palpating on someone else. The reason that works is because you're getting sensory information both from your palpating hand and from the area to be palpated, and so you're able to confirm that you're on these structures. So we're gonna go bone by bone in the elbow complex. So we're gonna have the humerus, the ulna, and the radius as a part of the elbow complex. So we're gonna start with the humerus, and the medial and lateral epicondyles are simply the widest part of the distal end of your humerus, okay? Have any of you ever seen the shirt that says, "I find this humerus," and then it's a picture of the humerus? Elliot has that shirt. It doesn't fit him anymore. It's very sad. So if you palpate your humerus and you're just pinching your upper arm and you come down until you get to the widest points, you're going to be on your medial epicondyle is going to be on the medial side, and the lateral epicondyle is going to be on the outside. Again, you always want to be in anatomical position to be able to label those regions. Those two bony structures are really important because many of the muscles that flex your wrist attach to your medial epicondyle. The muscles that extend your wrist attach to the lateral epicondyle. We have two very common overuse injuries that happen just distal to the epicondyles. So on the medial side, if you've ever heard of pitcher's elbow, that's going to be a medial epicondylitis. If you've heard of tennis elbow, that's going to be a lateral epicondylitis. Okay. Now, if you follow those ridges up, you're going to be palpating on the supracondylar ridge. Okay. Now, interestingly, this is going to be exactly the same as what we do for the knee. We're going to find the epicondyles and then the supracondylar ridges. The reason that those are important is simply because we have muscles that are continuing to attach proximal to the epicondyles. So that's it for the humerus for us. Okay, so we did a lot of palpation of the humerus proximally, but distally we don't have a whole lot of structures. Now, I don't have an olecranon to show you. Somebody had a sense of humor when they did their anatomy labeling because the head of the ulna and the head of the radius are at opposite ends of the forearm. Okay, so I'm going to go ahead and move our guy out of the way here. So if we start distally let's start proximally to the ulna, that's going to be our olecranon. Okay, and remember there's going to be a bursa directly over the olecranon. We talked about that when we did our palpation. So if it's swollen, you can't miss it because there's just this big fluid-filled sac just hanging off the olecranon. Okay, now if you follow along here, that's going to be the posterior border of your ulna. Okay, and it's going to come down. Now, for some of you, you're not going to have as big a knob as I do, but that is the head of the ulna. Okay, the styloid process is going to be lateral, and it's going to be the furthest most prominence of the ulna. Okay, so the styloid process of the ulna is going to be on the head of the ulna, and it's going to be that most distal bump hanging out down there. Okay, but the bump itself is the head of the ulna. Right, so we've got olecranon, posterior border, head of the ulnar styloid process. Okay, easy peasy so far, right? Okay, so remember when we said that the head of the ulna is here, if we go back to the elbow, we're going to have the head of the radius. So if you remember when we did palpation of joints, we are putting the flat of our hand on the lateral aspect of the forearm. You're going to rotate your forearm and you're going to feel the radius rotating underneath your hand. Okay, so our radius is what is rotating over the ulna, which is connected to the humerus. Okay, this is also our proximal radio-ulnar joint that we're feeling. The ligament that goes over the head of the radius, does anyone know what that's called? It's the annular ligament that holds the head of the radius in. I know for some of you, when we did this earlier, I let you palpate on this side. That's the ligament I tore on this side. Okay, so I have about a third of my radial head missing on my right, and I had a repair of my my annular ligament. I did that in PT school, and back in the day, they used fluoroscopes, which is a dynamic x-ray. And so I was at a teaching hospital, I was in La Crosse, so I was at Gunderson, and they brought in a bunch of residents, and they kept dislocating my elbow because it looked so cool under the fluoroscope. And you know, in PT school, I thought it was cool too until about like the 20th time. I'm like, stop it. Okay, so we've got our radial head, our annular ligament. There's not a structure you're going to feel for the annular ligament, just know where it is, okay? Then we're going to have our shaft of the radius. Now, if you're in anatomical position, it's going to be on the lateral aspect of your forearm, okay? Now, if you get to the thumb side of your hand, you're going to get the radial styloid process. It's going to be lateral. It's going to be the most distal prominence of your radius. So this is where things get goofy, right? Because your radial styloid process is not on your radial head. But the ulnar styloid process is on the ulnar head. Okay? Both styloid processes are the most distal prominences of the ulna and the radius, respectively. Okay? Now, if you palpate on the dorsal surface of the radius, you're going to feel a little groove and a little bump. Okay? That bump is Lister's tubercle, and it serves as a pulley for one of our hand muscles. And we're going to use Lister's tubercle as a way to identify bones in our hand. Okay? So Lister's tubercle is going to be that bump on the palmar surface of your distal radius. This is different than the ulnar styloid process, okay, which is going to be here. So that's Lister's tubercle. Now, to palpate the distal radial ulnar joint, Andrew, maybe I'm going to have you just turn around here, and I'm going to have you have your elbow bent up. Let me take this chair. So, we talked about how you palpate the integrity of the proximal radial ulnar joint is by having your hand on the lateral elbow and having the person rotate, right? For the proximal radial ulnar joint, what you're going to do is have the patient with their elbow bent, and you can relax for just a second. I'm going to grab the radius with one hand and the ulna with another, and I'm going to do a translational movement of that distal joint. What I'm not doing is rotating his arm. I'm not pronating and supinating his arm. I'm doing a shear between one hand and the other. Now remember that we don't want to be moving both hands. We want to have one hand stable and move the other, stabilize the other hand and move the other. Okay? So go ahead and relax for me. So I'm using, this is called your thenar eminence. So I have my thenar eminence on his radius, on his ulna, and then I've got my fingers on the other side, and I'm going to just shear. Okay, so that right now I'm moving my left and not my right, but I can also hold my left and I can move my right. Okay, and I'm feeling for those ligaments that hold the distal radial ulnar joint together. Okay? So those are all the osseous structures of the elbow. So go ahead, go to it. It's fan-shaped, and so you'll just know where the structure is. So you're going from the olecranon over to the condyles and palpating in between there. Okay? But for the ulnar collateral ligament, there's going to be a band, and you should be able to feel that band if you go cross fiber. Now, we are not going to be palpating ligaments for integrity because you can't feel an absence of integrity. You're really looking for the location of symptoms. Okay? Feeling?
Yeah.
Did you have a question? Oh, I thought you had a question.
Sorry, I was just
trying to find it. Now, we already talked about the annular ligament in that is the ligament that's holding our radial head together. And that, again, you're not going to feel the structure. You just need to know where it is. So you're going to be just distal to the radial head. Okay? And then we talked about the bursa on the olecranon. So why don't you palpate those? So palpate the ligaments of the elbow. And what else was on that last slide? Oh, and the ulnar nerve and the arteries. Medial border, so coming over this way, is going to be our pronator teres. Our pronator teres is going to be a two-joint muscle. It crosses both the elbow and then the proximal radial ulnar joint. That's going to be important because we can do some things to try to get that isolated from the other pronator muscle that's down in the forearm. The lateral border is going to be the brachioradialis. Okay, so if you have your elbow bent at 90 degrees and you resist, that muscle that pops out on the top of your forearm is going to be your brachioradialis. It's also going to be this lateral border of this cubital fossa. Okay, all right, next one. Now, for the muscles that attach to the medial epicondyle, we have our pronator teres, which we just talked about. Flexor carpi radialis, okay? So that's going to be a muscle that flexes our wrist and then moves it to the radial side, okay? So it's a flexor carpi radialis. That's going to attach to our medial epicondyle. Our palmaris longus, which is the one where if you bring it together, not everyone has the palmaris longus. Okay, so you're going to flex your wrist and bring your pinky and thumb together. And then your flexor carpi ulnaris. So your flexor carpi ulnaris is going to flex your wrist and then move it to the ulnar side. So these are the four muscles that are going to attach to the medial epicondyle. And here you can see the order that they run in. Okay? All right, next slide. Oh, I can do it. I'm here. So for the lateral muscles that are attaching to the lateral epicondyle, we have extensor carpi radialis longus. So now it's going to bring our wrist up, and it's going to go towards the radial side. If we have a longus, you know there's going to be a brevis, right? So then we've got extensor carpi radialis brevis. Also going to be extending and moving towards the radial side. We have extensor digitorum, which is going to be extending our fingers. And then our extensor carpi ulnaris, which is going to extend and move us to the ulnar side. So these are the muscles that are going to attach to that lateral epicondyle. Okay? And you see in this picture how it's also traveling up that supracondylar ridge. Okay? Now, if in these cases of these overuse injuries, there's too much pressure that's being put in a small spot. You can tell these are really muscular attachments. So some of you may have seen those tennis elbow straps to help try to diffuse that force. Okay? So this again, I just like it as an image because it shows the order of those muscles coming off of that lateral epicondyle. But if you want to palpate extensor carpi radialis longus, if you extend and go to the radial side, that's the muscle that's contracting. Okay? All right.